Today, we're going on a diagnostic journey to really get our heads around a condition called fetal growth restriction, or FGR. It sounds complicated, I know, but we're going to break down exactly how it's spotted and what happens next, one step at a time.
So it all boils down to this one question. For any parent-to-be or doctor, it's a concern that kicks off a really careful, methodical investigation. The number one priority? Making sure that baby is healthy and safe. So let's follow that investigation and see how they do it.
All right, let's dive in. Here's our game plan for this explainer. First, we'll talk about what FGR really is. Then we'll look at how doctors find the very first clues, use some pretty amazing technology to get a clearer picture, and then how they make the right call. We'll wrap up by looking at the bigger picture, the risks and the causes.
First things first, we've got to get one thing straight. Not every baby who's on the smaller side has a growth problem. And making that distinction, telling the difference between just being small and having a real issue, well, that's the absolute most important first step.
Okay, so this is where things can get a little confusing, but it's super important. On one side, you have small for gestational age, or SGA. The best way to think about this is that it's just a description, a measurement. The baby's weight is in the bottom 10% for their age. That's it. But FGR, on the other hand, is an actual diagnosis. It means the baby isn't reaching its growth potential because of an underlying issue, usually that the placenta isn't working at 100%. So one is just an observation, the other is a genuine call to action.
So, how do doctors even get the first hint that a baby might not be growing the way it should be? Well, it all starts with a very routine but very crucial screening process.
The path to discovery often starts with something surprisingly low-tech. At a regular prenatal visit, a doctor or midwife uses a simple tape measure to check the symphyso-fundal height. If that measurement is smaller than expected for how many weeks along the pregnancy is, it's not a panic button, but it's definitely a flag. It's a signal to the team that they need to dig a little deeper, which leads right to the next step, a detailed ultrasound to get the exact measurements of the baby.
Okay, so an issue has been flagged, and now the investigation really deepens. Just knowing the baby's size isn't enough. Doctors need to know how the baby is actually doing in there. And this is where a really powerful piece of ultrasound tech called Doppler comes into play.
Getting a clear picture of how a baby is doing is kind of like putting a puzzle together. They look at the baby's abdominal circumference, that's a huge indicator of nutrition, and they compare it to the head size. But honestly, the most critical piece of the puzzle, the real game changer for checking on the baby's well-being when FGR is suspected, is the umbilical artery Doppler.
Just think of the umbilical cord as the baby's lifeline, right? It's the supply line for everything. A Doppler study basically lets doctors listen in on that lifeline. It measures how blood is flowing between the placenta and the baby, giving them a direct look at whether that supply line is working perfectly or if it's struggling.
Now, within those Doppler readings, there are certain patterns that are massive red flags. And this phrase right here, absent end diastolic flow, is one of them. It means there's a lot of resistance in the placenta, and blood isn't flowing to the baby properly when the heart is relaxed between beats. It's a very serious sign that the placenta is in trouble, and it demands immediate, careful management. So, with all this data, the size measurements, the ratios, and these crucial blood flow patterns, doctors find themselves at a crossroads. They have to weigh every single piece of evidence to come up with a plan that's tailored specifically for that mom and that baby.
This table really just lays out the delicate balancing act they have to perform. Take a look. At 33 weeks, if the blood flow is normal, the plan is basically watchful waiting. They'll monitor with scans every couple of weeks. But look what happens when that absent end diastolic flow shows up after 32 weeks. The whole game changes. At that point, the risk of staying inside the womb is greater than the risk of being born a bit early. The plan shifts completely. Give the baby steroids to help the lungs mature and get ready for delivery.
All right, to finish our journey, let's zoom all the way out. Why does FGR even happen in the first place? And why is all this work to diagnose it so incredibly important? Understanding the context really helps us grasp the full weight of the situation. FGR often traces back to maternal health conditions that can affect how well the placenta works. Things like preeclampsia, which involves high blood pressure, can actually damage the placenta's blood vessels. And other factors you see here, like kidney disease or recurrent bleeding, they also put a ton of stress on that whole system that's supposed to be supporting the baby. It really drives home how a mother's health is directly tied to the baby's growth environment.
And this is why that whole diagnostic journey is so vital. FGR isn't just about being small, it's about actively preventing some very serious outcomes. When the placenta is compromised, it can lead to problems after birth like low blood sugar or jaundice. In the most severe cases, it can even lead to brain injury or, tragically, intrauterine death. The whole goal of all this monitoring is to step in before any of that can happen, to give every single baby the absolute best possible start.
So if you remember one thing from our explainer today, let it be this. Fetal growth restriction is so much more than a baby's size. It's about a shift in focus from how big is the baby to is the baby thriving? It's all about protecting a baby's potential.
It's really incredible when you think about it. The diagnostic tools we have today allow doctors to intervene and support these vulnerable pregnancies, turning a story of risk into one of resilience. But it leaves us with a big, forward-looking question. What's next? How can we get even better at predicting FGR right from the very beginning? That's the next frontier.